If you've ever spent any time Googling diets that help reduce inflammation, you've probably come across something encouraging the elimination of vegetables belonging to the nightshades family. These include peppers, white potatoes, tomatoes, and eggplant. You might be thinking, wait a minute, haven't we always been told to eat more of these foods because of their supposed health benefits? Such vegetables have attained a bad rep largely because of another plant belonging to the nightshades family called belladonna. Belladonna is a notoriously toxic plant that produces compounds called solanines, which are poisonous to humans and in large concentrations cause delirium, hallucinations, and even death. While the solanine content in all vegetables cultivated for human consumption have nowhere near the solanine concentration found in belladonna, all foods belonging to the nightshades family do in fact contain some of this toxic compound. As a result, people with arthritis and other conditions have long been advised to avoid these vegetables because the solanines are said to contribute to inflammation, joint pain, and swelling. So, is this idea just an old wives' tale, or does the research actually check out? That's what we're going to be discussing today, so stick around to find out. If we haven't met yet, my name is Megan. I'm a registered dietitian and I am dedicated to helping people sift through the false nutrition messaging out there by sharing credible, evidence-based information. First and foremost, let's take a minute to talk about inflammation, because I think this is a word that we throw around a lot, but let's define it. There are two types of inflammation, chronic and acute. Acute inflammation occurs when our bodies encounter something harmful and foreign, like a virus, bacteria, toxic chemical, or if we get injured. You may or may not be familiar with what are referred to as pro-inflammatory mediators. These are essentially measurable indicators of inflammation that we can detect through a blood test and include tumor necrosis factor alpha or TNF-alpha, the interleukins like IL-6, and C-reactive protein or CRP. There are others, but these are the general ones that you'll hear me refer to throughout today's discussion. These mediators act like first responders. They're the first on site when a threat to the body occurs and signal the immune system to mount an attack against the offending agent. While inflammation is generally viewed as a bad thing, it's actually very necessary and quite literally keeps us alive. It is because of our inflammatory response that we're able to rid our bodies of infection, heal damaged tissue, and prevent pathogens from entering our bloodstream when we get a skin injury like a cut or a burn. Where inflammation becomes harmful is when these pro-inflammatory cells are constantly getting sent out even when there's no danger. This most notably happens in autoimmune conditions like rheumatoid arthritis or lupus, where the inflammatory response goes sort of haywire and mistakenly sees the body's own tissues as a foreign threat and attacks it. This leads to pain and other complications. However, autoimmune conditions are not the only cause of being in this sort of state of chronic low-grade inflammation. This can also be caused by lifestyle practices like smoking cigarettes, leading a sedentary lifestyle, stress, and eating a poor diet where we're not getting enough important nutrients. This is the type of inflammation that is associated with the development of diseases like diabetes, heart disease, cancers, and Crohn's disease. So this brings us to the question of whether or not nightshade vegetables cause inflammation. This is something that the American Arthritis Foundation has looked into pretty extensively and has concluded that there is no evidence at this time suggesting that nightshades contribute to increased inflammation in humans. However, it is very possible that there is just not enough evidence in this area to say either way. There are very few studies actually looking at the inflammatory response in relation to solanine ingestion. I did find one small study conducted in rats, which found that when 2/3 of the diet was replaced by diseased potatoes, there was a positive correlation between serum levels of CRP, TNF-alpha, IL-6, and IgG. The authors concluded that these study findings indicate a possible benefit to limiting or avoiding nightshade vegetables to reduce joint pain and prevent the destruction of tissues. So do I think that we should take these study findings and run with them in terms of making recommendations for anti-inflammatory diets in humans? Not necessarily. My guess is not a lot of studies have been done in this area because it's very hard to control for other things that could prompt an inflammatory response. For instance, if we look at this study, we know that the immune system can be triggered in the setting of a nutritionally deficient diet. If the majority of what the rats were eating was diseased potatoes, that in and of itself could contribute to that. Additionally, what other things could be lurking in a batch of essentially bad potatoes that could trigger the immune system? Probably a lot of things. And you might ask, why diseased potatoes? While the solanine concentration in white potatoes alone is pretty insignificant, the amount does increase pretty drastically when the potatoes are exposed to light and allowed to sprout or develop green spots. This was likely an effective way to get a meaningful amount of solanine into the rats in order to be measured for the study. If the lack of research regarding solanine ingestion and inflammation is concerning, that's fair. That being said, I think it's important that we not look at solanine ingestion in isolation, but that we sort of zoom out and consider all of the other nutrients that we find in nightshade vegetables, particularly antioxidants. Antioxidants are incredibly important for supporting our immune system. Research has shown that phenolic compounds like anthocyanins, which is what gives the peel of eggplants that deep violet color, and vitamin C in peppers have robust antioxidative effects that significantly inhibit pro-inflammatory mediators like TNF-alpha and pro-inflammatory cytokines. What this means is the properties we find in these vegetables are actually anti-inflammatory. Additionally, tomatoes are rich in the powerful antioxidant lycopene, for which there is strong epidemiological evidence suggesting that it protects against the development of prostate and lung cancers, as well as heart disease. Nightshades are also rich in other important nutrients like potassium, folate, iron, and fiber. That brings us to another question. If nightshades are not linked to inflammation, should we at least be concerned that solanines are in fact toxic? There have been reported cases of solanine toxicity, although cases have occurred almost exclusively after the ingestion of potatoes that have been stored improperly. This is what happened in 1979 when a group of schoolboys ate a batch of boiled potatoes that had been left in storage since the previous term. About 80 staff members and students became ill. An investigation was conducted that found solanine poisoning as the cause of their illness. Do I think this means that you should worry if potatoes are a staple in your diet? No. As we previously discussed, the concentration of solanine does increase when the potatoes have developed green spots or sprouted, but you would have to eat 14 large white potatoes before toxicity would even be a concern. If it's another nightshade vegetable like tomatoes, which is technically a fruit, but you get what I'm saying, you would have to eat approximately 130 pounds or 250 medium-sized tomatoes to achieve toxic levels of solanine. Even if it were realistic to eat that quantity in one sitting or even a 24-hour period, solanines are poorly absorbed and rapidly excreted by the body. It may be best practice to avoid green areas on potatoes, although it's likely that we're probably already doing this anyway because we have a natural aversion to the bitter taste. But otherwise, the chances of toxic levels of solanine actually getting into your system is pretty unlikely. Are there certain situations where nightshades should be avoided? Just like pretty much any other food out there, there are rare cases where somebody might have an allergy or intolerance to nightshades, in which it may be necessary to avoid or limit consumption of them. These can manifest as digestive issues, including loose stools, bloating, nausea, and vomiting. Other common signs include hives, red skin, itchy eyes, and excessive mucus production. A food intolerance is usually identified through doing an elimination diet where foods suspected of causing problems are eliminated and systematically reintroduced one at a time to determine the exact source and quantity that causes symptoms. If you suspect you may have a nightshade intolerance, I would recommend not attempting an elimination diet on your own, as risks of nutrient deficiencies are higher since the initial stages can be quite restrictive. Working with a trained professional ensures that you are getting all of the important nutrients that you need, so you are not eliminating things unnecessarily. A doctor can diagnose a nightshade allergy by performing diagnostic tests such as a skin prick test, where a bit of an allergen is injected into the skin with a needle to test for a reaction. There is one last thing I think is worth mentioning. I did find some research highlighting potential negative effects of solanines on embryonic development and possible risk of neural tube defects. While I think this is an area where more research is needed, it may behoove women who are trying to get pregnant to avoid consuming sprouted potatoes during the periconception period. This is the time frame of 14 weeks before and 10 weeks after conception. In summary, with the exception of rare cases where there may be a food intolerance or allergy, it is my professional opinion that the benefits of eating nightshade vegetables far outweigh any small chance that the solanines induce an inflammatory response. We have a robust and long-standing body of research suggesting that the phenolic compounds we otherwise find in these foods have anti-inflammatory benefits that may play an important role in preventing many diseases. I think it is a much better use of our time and energy to instead shift our focus onto the things we know reduce chronic inflammation, like exercising, stress reduction, not smoking, or maybe getting help with smoking cessation. And of course, getting a healthy, balanced diet with lots of fruits, veggies, protein, and good healthy fat to help boost our immune system, and limiting our intake of processed foods. Thank you so much for watching. If you like this video, please give it a thumbs up and let me know in the comments if you have any suggestions for future video topics that you'd like me to cover. With that, I'll see you next time. Bye.